Hi guys, Dr. Aquino here from Replenish. I'm here with Alberto this morning, and we're going to talk about our immune drips and questions he may have.
Well,
Alberto,
Doctor, how are you?
welcome.
Thank you.
Thank you.
So, what am I taking today? What are you giving me?
Well, we start with what we call the immune boost. The immune boost is designed to build your immune system. Now, it's very, very important that people know this is not a cure. This builds your immune system so you're able to fight off infections. If you've never been exposed and then you get exposed, this will help you build off and build antibodies so you don't get an infection. If, unfortunately, God forbid, you had an infection, this will help you get rid of the infection. Immune boost is very simple. First of all, it's fluids, about 500 cc's of normal saline, which you always have to hydrate people. There's what we call high-dose vitamin C, about 25 grams. And then studies have shown that zinc and selenium help the immune system, so we add that. In addition, sometimes we'll add magnesium. The studies have shown that the magnesium help build off and then build antibodies to stop infections. And then we always follow what we call the glutathione. Glutathione is a special chemical that flushes out your liver. And when it flushes out your liver, it allows your body to detox and clean out. We then add, at the final part, vitamin D. D like dog as a shot. Because again, studies have shown people that have good vitamin D levels build antibodies and they fight off infections.
So the mix in the IV, where does that get prepared?
We have a preparation room. It's all sterile. It's only done by professional nurses, and we do that right before the patient drips. We do not mix until the patient's in the office, and there's a time that you can keep that. But what we do is the patient comes in. Okay. Any other question?
Yeah, and what is the difference between like taking supplements? If I take supplements at home, oral.
Good question. The problem there is that a lot of them don't get absorbed. And the other thing is that you can't compare how much supplements you get in intravenous, because this is instantaneous and it's high dose. We usually put people on a 6-week regimen where they get the intravenous for 6 weeks, and that builds up their levels. Once their levels are built up, we then put them on the orals, and even though they don't absorb well, at least they have a good level in them. We also do blood work, and we look at the levels in your body. We'll look at your vitamin D level. We look at your zinc level, and that tells us what to do.
Okay, and lastly, how am I gonna feel after this? Like, do I take a nap this afternoon?
Yeah, most people right after the drip, they feel a little tired. And that's because the body's equilibrating. But by tomorrow, you're gonna feel like a new man. Your energy, you think straight. It's a wonderful thing. The important part is that you need to follow. And people need to follow with the weekly drips, and you need to follow with the blood work. But I think in general, we've had great results with this. So I hope you feel much better, Alberto. Okay?
Thank you. Thank you, Doctor.
My pleasure.